Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's May 2025 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is a review article entitled The Effects of Commonly Prescribed Medications on Sleep, a review of the literature. It is authored by Dr. Luke Klughertz and colleagues from Mayo Clinic in Rochester, Minnesota. Adequate amounts of quality sleep not only regain for us mental acuity, physical energy, and emotional vigor, but represent a physiologic imperative for us. This imperative ensures, among other functions, cardiovascular and reproductive health, hormonal regulation, integrity of the immune system, and mentation and memory. Sleep disturbances promote diseases that include metabolic syndromes, hypertension and assorted cardiovascular diseases, neurologic and psychologic disturbances, and impaired immune responses. The importance of sleep and the frequency of sleep disturbances in patients, which may exceed 50%, led Mayo Clinic to recently publish Mayo Clinic Guide to Better Sleep, a book authored by sleep specialists at Mayo Clinic Center for Sleep Medicine, Drs. Morgenthaler and Kohler. Dr. Kohler is the senior author on the review article by Klughertz et al. In this issue of Mayo Clinic Proceedings. This in-depth review builds upon the much briefer discussion on prescribed medications and sleep in Mayo Clinic Guide to Better Sleep. Klughertz et al. Based their current review on an encompassing PubMed search over the past 10 years, their clinical experience and expertise, and by specifically examining medications commonly prescribed in clinical practice for which there is sleep-related literature. Hypertension is present in some 50% of the U.S. population, the majority of whom are prescribed antihypertensives. Of the antihypertensives in use, beta blockers are commonly associated with sleep disturbances, with attendant sleepiness and fatigue, whereas ACE inhibitors, ARBs, and calcium channel blockers have a neutral association with sleep. Interestingly, diuretics have a beneficial effect on obstructive sleep apnea by reducing the apnea-hypopnea index and increasing nocturnal oxygen saturation. These effects are offset by diuretic-induced nocturia. Prescription of statins have significantly increased in recent years, and while there are rare descriptions of insomnia and nightmares, statins generally do not disturb sleep. Antidepressants exert divergent effects, as some may cause insomnia while others somnolence. Phosphodiesterase inhibitors prescribed for erectile dysfunction may worsen obstructive sleep apnea, whereas proton pump inhibitors used for gastroesophageal reflux disease may exert beneficial effects on sleep. This comprehensive and timely review by Klughertz et al. Underscores the need for clinicians to carefully consider prescribed drugs as a cause for sleep disturbances, and to weigh such sleep disruptive effects of these medications against the intended benefits for which such medications were initially prescribed. Our first highlight article this month is an original article entitled Self-Monitoring of Blood Pressure and Feedback via the Mobile App in Treatment of Uncontrolled Hypertension, the SMART Blood Pressure Randomized Clinical Trial. It is authored by Dr. Min Jae Yoon from Seoul National University Bundag Hospital and Seoul National University College of Medicine in Seonnam, Korea, and colleagues from other universities and institutions in the Republic of Korea and from the Arctic University of Norway in Tromsø, Norway. Effective hypertension management requires blood pressure monitoring in conjunction with appropriate therapeutic responses such that blood pressure is maintained in the desired range. Both components may be aided by approaches based on mobile health applications and artificial intelligence. How such technologies currently available in our digital age may be applied to hypertension management has been highlighted in a recent perspective in Mayo Clinic Proceedings. An important aspect of this topic is addressed by an original article by Yoon et al. In the present issue of Mayo Clinic Proceedings. These investigators undertook a randomized, open-label, multi-center trial in Korea that assessed the relative efficacy of self-monitoring of blood pressure by a mobile platform that also provided feedback for patients. Such feedback included alerts for blood pressure measurement and additional recommendations from the app based on an algorithm in response to measured blood pressure. Patients were also specifically queried whether their measured blood pressure was high, normal, or low, and whether they took their drugs as prescribed, and were reminded to do so. The control group consisted of patients who measured blood pressure at home using the mobile app, but were not provided any feedback. This study, conducted from September 1, 2019 through July 31, 2020, randomized 184 patients to either of these two groups. Following randomization, patients were seen by healthcare specialists at 12 weeks and at 24 weeks, with blood pressure management altered if blood pressure was not within the target range. The Korean guidelines generally recommend a blood pressure target of 140/90 or lower. The essential finding was that at 24 weeks, reduction in blood pressure from baseline values was greater by some 5 millimeters of mercury in patients in whom, in addition to self-monitored blood pressure, feedback was provided, when compared with the control group, in which self-monitored blood pressure alone was monitored. Additionally, the intervention group had greater adherence to their prescribed blood pressure lowering agents, such compliance being 95% or greater in the intervention group. This timely study underscores two salient considerations, among others. First, it shows how mobile health platforms may be developed to provide relevant feedback for patients such that both blood pressure control and drug compliance are improved. Second, such feedback promotes patient awareness, vigilance, and interaction in the management of hypertension. As such, this study persuasively speaks to the increasingly recognized notion that improved healthcare outcomes generally occur when patients are more actively engaged in the management of their disease. Our second highlight article this month is a concise review article entitled Diagnosis and Management of Gastroesophageal Reflux Disease, a concise review for clinicians. It is authored by Dr. Hannah Phillips from the Department of Internal Medicine at Mayo Clinic, Rochester, Minnesota, and colleagues from Cedars-Sinai Medical Center in Los Angeles, California, and Mayo Clinic in Rochester, Minnesota. Gastroesophageal reflux is generally opposed by the lower esophageal sphincter and the crural diaphragm, with any reflux gastric contents returned distally by esophageal peristalsis and gravity. Salivary and esophageal submucosal gland secretions mitigate the injurious effects of any reflux gastric contents. GERD may manifest itself by typical symptoms such as heartburn and gastric acid regurgitation. Atypical symptoms, for example, dysphonia, cough, chest pain, others, or alarm symptoms which include dysphagia, anemia, gastrointestinal bleeding, and weight loss. How GERD is diagnosed and treated are largely dependent on its presentation, severity, and complications. EGD enables the diagnosis of the complications of GERD, which include erosive esophagitis, peptic strictures, and Barrett esophagus, the latter representing a prelude to esophageal adenocarcinoma. Ambulatory pH testing provides a complementary approach in the diagnosis of GERD and its related syndromes. Such testing uses pH less than or equal to 4 as a threshold for pathologic reflux and employs as its essential metric the acid exposure time. Phillips et al. Provide a very helpful diagnostic algorithm for GERD. For example, the presence of typical symptoms without atypical or alarm symptoms and with an effective therapeutic response to an empiric trial of proton pump inhibitors makes the diagnosis of GERD likely. When GERD-related complications are absent on EGD, diagnostic evaluation is facilitated by the acid exposure time. For example, GERD is diagnosed when the acid exposure time is greater than 6%. Reflux hypersensitivity when the acid exposure time is less than 4%, but there is positive symptom association. And functional heartburn is diagnosed when the acid exposure time is less than 4% and there is no symptom association. Phillips et al. Discussed the management of GERD by first emphasizing the importance of lifestyle modification, the latter including weight reduction, elevation of the head of the bed, and avoiding instigating foods and alcohol. They review the utility, indications, and adverse effects of antacids, histamine 2 receptor antagonists, proton pump inhibitors, and potassium competitive acid blockers. Surgical intervention, including hiatal hernia repair, may be indicated in patients resistant to medical management. This concise review by Phillips et al. Admirably distills the essential information regarding GERD, a disease that's commonly bothersome, may be difficult to effectively manage, can lead to major complications, and is so commonly seen in general and subspecialty practice. You can access these highlights and editor's choice articles free of charge during the entire month of May. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the links in the gray bar at the top of the home page from the Connect menu to follow us on Facebook, X, formerly known as Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. In addition, our website also includes our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on the home page as well as through iTunes. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings. or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.